certain parts of the state, will continue to place an emphasis on testing. We always talk about what an important tool testing can be, and having increased capacity and a more specific driven goal in terms of what we want to do with testing, both within the general population, how we deal with it within long-term care facilities, how we use it with our hospitals, as we start expanding with operational procedures and surgeries. It's all going to be a very important part of the puzzle. We have our mobile testing teams. We have remote access sites across the state for those who may not live close by to a hospital or a healthcare facility. And we have our fixed locations, as well as all the locations at the Convenient MD facilities, 11 Convenient MD facilities across the state, and locations that are currently doing testing as well. We've opened up testing to Granite Staters by urging doctors to recommend a COVID-19 test to anyone displaying symptoms. And today we're announcing that we are going to further expand this effort by setting up an online web portal to allow for Granite Staters to sign up and reserve a test in advance by going online. Tomorrow morning, we will put a link on the nh.gov homepage that will allow anyone in the state to sign up for a test. In order to sign up for a test, you must simply self-attest that you have one of the COVID-19 symptoms, which could include fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, or a loss of taste or smell. And you can request a test if you are a healthcare worker, 60 years old or more, with someone with chronic lung disease, or moderate to severe asthma, serious heart conditions, someone that might be immunocompromised, obesity, diabetes, chronic kidney disease, or liver disease. So we've tried to add a whole plethora of options and potential ailments or symptoms that someone might have to make sure that they have access to a test. Expanding our testing capacity in this way is going to be I think a very important tool as we go forward. The portal will allow for anyone to simply go online, select from one of the 5 remote fixed sites we've established in Claremont, Tamworth, Rochester, Plymouth, and Lancaster, and choose a time and day of the week that they want to come in and have their test done. Anyone, regardless of their financial or insurance status, will be able to receive a test. And again, I think it's a great opportunity for our citizens and our state to be very refined as we take our next steps forward. Another area where we're working hard to address is childcare. We've got a lot of questions and concerns about our childcare over the past week, and on March 26, as many will remember, we established the Emergency Childcare Collaborative, an effort put in place to ensure New Hampshire's essential workforce could continue to receive childcare. And this effort was stood up in under a week, and approximately 265 different childcare centers are currently open, serving approximately 5,300 children across the state. We put forward financial incentives, and to date, over $500,000 has been deployed to local child care centers across the state. There are roughly 1,500 open slots across the state and an additional 100 centers that have met the Emergency Child Care Collaborative designation but have yet to reopen simply because of demand. But we imagine as our economy starts to take these initial steps with new opportunities, we imagine the demand will increase, but it's important for the citizens to know that the capacity will be there. As we continue to move forward with taking steps to reopen certain parts of our economy, we know that the demand will increase. We've already had dozens of child care providers reach out to us just in these past few days to take part in this collaborative, and we expect that number to continually grow. As these centers open up, they'll have to follow the strict guidelines originally established by the Department of Public Health, but we'll also have the Governor's Reopen Task Force taking a look at those guidelines as well to make sure everything comes in to a unified conformance. At this time, I'm going to ask Commissioner Shibinette to come up and give a public health update and talk a little bit more about our long-term care prevention plan.
Okay, thank you. So I want to rewind a little bit about in regards to how this plan was created and was crafted. So if we rewind to a couple months ago and we look at the landscape of what was going on with COVID-19, and we look at the states that came before us and even the countries that came before us, you know, one of the big concerns that came out of watching how COVID-19 played out in those areas was the overcapacity of the hospitals, right? So very early on, we focused on alternative care sites and hospital capacity and things like that. As we watched New Hampshire unfold, it unfolded very differently in this state than what we've seen in other states, where we have seen other states have this surge of community-based transmission and community-based death and illness. New Hampshire, after putting in restrictions and doing a variety of social distancing techniques and masking and things like that, we've watched that our community transmissions and our illness rates in our hospital, current hospitalizations and things like that start to either level out or decline. What we did not see is that same trend happening in long-term care, and I, based on our numbers in long-term care to date, we took some very aggressive action early on, and I think at this point it's time to take further steps to address some of the long-term care testing issues. So, to date, we have tested over 1,000 nursing home residents across the state, which is a great number. We want to test more. To date, we have tested over 5,000 long-term care workforce members just in the last 3 to 4 weeks. Just in our Convenient MD project that we did in Rockingham and Hillsborough County, we tested to date, and this is, we're still following up on some of them, 4,200 tests, and we identified 93 positive cases in 19 different facilities across the state. Many of those facilities never ended up with an outbreak of those 19 facilities. That's a very positive statistics that we look at, is that we were able to identify a asymptomatic staff member in that facility prior to the facility having any illness in their residents. We think that is a success to be able to identify that, so we would like to continue doing that. So if we look at the long-term care data, and then so the staffing, or the resident testing. So what our plan is for resident testing. If we could go there. So this data is an interesting data chart. 111 total deaths in New Hampshire today have not been associated with long-term care. 22%, 24 have not been associated with long-term care facility outbreaks. 87 or 78% have been associated with long-term care facility outbreaks. On our next slide, we see that long-term care and the proportion and the exponential growth in long-term care cases is happening across the country. On the bottom half of this slide, you will see 20% increase in long-term care facilities experiencing COVID-19 cases. On 4/23, there were 4,000 facilities, 4,069. On 4/29, there was 5,093. Same goes for 44% increase in cases in long-term care facilities from 50,000 to 91,000, and 37% more COVID-related deaths, 10,000 up to 16,000, and that's just in merely a week. And New Hampshire is obviously having similar problems. So we're just this past Monday, we received our testing supplies from our federal government that allows us to go out and do surveillance testing or community-wide testing. And this had been something that we were waiting for. We had supplies and the lab supplies, specifically the viral transport medium, that we were waiting for to be able to do this testing. So we received the supplies on Monday, and in addition to that, we also validated a process called an interior nasal swab. So anybody that had experienced having a COVID-19 test done prior, it was a fairly uncomfortable procedure needing to go pretty far back in the nasal cavity. We have validated now that we can do an interior nasal swab, which makes it much easier, and especially easier for people that are going to have ongoing repeated tests. So each facility is going to be provided supplies. So in the coming 2 weeks, because we are able to do the interior nasal swabs, what that prevents is needing to have a testing team to go into every facility, to take tests from long-term care residents. As I've spoken at numerous press conferences in the past, we're very wary of sending testing teams into facilities that have had no signs of illness whatsoever. So what the anterior nasal swab allows us to do is to send the supplies to the facility and have the facility staff take the swab and then send it back to the public health lab for testing. And this is a great advance for our ability to test our long-term care residents. So over the next 2 weeks, we're going to go by geographic region. We'll be coordinating with sending out the supplies and the instructions on how to do the anterior nasal swab and have it sent back to public lab. And we will do a baseline of all residents in a facility that have not tested positive since COVID-19 started. After that, we plan to begin what's called a Sentinel surveillance project with long-term care facility. Every week, we will randomly select 10 facilities, or about 10% of our facilities, and ask for swabs on 10% of their resident population. So this allows us to get a really good diverse set of swabs from different facilities around the state to understand whether COVID-19 is coming into their resident population undetected in an asymptomatic resident. So nursing home staff testing is the next area that we'd like to improve on. So for the past several weeks, we've tested over 5,000 nursing home staff members. But as we all know, testing once is not enough. So we can test someone once and have them come in contact with COVID-19 2 or 3 days later when they're out in the community. So in order for us to have an effective testing program, really, we've talked a lot about the fact that we need to stop this virus at the door. We need to be able to stop it before it gets to the residents. So we are putting together what we're calling a serial testing program for the long-term care staff. Right now, we have Convenient MD doing mobile testing. Our next step is to stand up 7 to 9 mobile teams, both with the National Guard, some of our private partners, and Convenient MD. Our goal is to go statewide and offer testing to all long-term care nursing home staff members every 7 to 10 days. Very important part in our program. As we said, we want to stop this at the door and not have it get into the resident population. Our resident population unfortunately, do not have the option to socially distance from their caregivers. And it's very, very difficult in the throes of having personal care done to be able to, for a resident to don a mask or to maintain a distance that stops the spread of COVID-19. So making sure that the staff have ongoing and regular regular testing is really, really important. In addition to doing the serial testing, if at any time in between those 2 testing sites that a facility or a staff member decides that they want to be tested, they can go on to the website that the governor just talked about and schedule themselves an appointment. These testing sites are open to healthcare workers. You do not need a physician's order to do it. You can go on and schedule the time that works for you. We are out there 7 days a week, 8 hours a day to do testing. Next slide. So community testing and surveillance, and the governor touched on a lot of this already. Next slide. We have 5 fixed sites in Plymouth, Tamworth, Lancaster, Rochester, and Claremont. We plan to have those additional sites, mobile sites, just for our long-term care teams. A couple of things that we are sending to these sites. Critical businesses that want to have their employees tested prior to coming back to work is something that we will be looking at doing in the near future. Being able to set up a time for businesses to send their employees, especially ones that are over the age of 60 with underlying conditions and in any type of condition or healthcare status, especially healthcare workers, to come to those sites. Anyone with symptoms, underlying conditions over the age of 60 or as a healthcare worker can schedule an appointment to be tested. Convenient MD can also do testing on all of the above populations, and you can also schedule a test at 271-5980. That is our central coordinating office that is scheduling tests. So starting tomorrow, you can use our website, which is the N8. Sorry, I'm blanking on the website. COVID-19 the New Hampshire government website with COVID-19, and there it is. nh.gov/COVID-19. You can go there starting tomorrow, press the button on the right side of the screen and schedule your appointment. You will be given a follow-up call by someone from our central coordinating office to schedule that appointment, or you just can call the main number, and the main number will get you directly to our scheduling office, and that starts tomorrow. That's all I have. Thank you.
Commissioner, I'm going to pull you right back. Were we going to do a public health update? Okay, great. We just want to give some numbers of the daily numbers for folks. I know some folks in the press were looking for the daily numbers. So you did such a great job. We're going to bring you right back up. Very great.
So today we are announcing 108 new cases of COVID-19 for a total of 2,740 cases. We have 1,110 recovered. We are announcing 19 new deaths today. That's 19 for a total of 111 deaths. Our current active cases are 1,519. We are testing rate over 28,000 tests to date for New Hampshire citizens, and we're monitoring about 2,900 people. Thank you.
Great. Thank you very much. With that, I guess we can just start opening it right up for questions for folks. Yeah.
Governor, just how do you contrast this, looking forward, trying to reopen the economy when we see more of these days like today where double-digit fatalities? How do you square that?
So I think what we're talking about is the idea that a majority of cases that we're seeing, and unfortunately a lot of the fatalities that we're seeing, are in these long-term care facilities, and we're trying to look at that at a very micro level, if you will, a very granular level, to make sure we're separating out what's going on in kind of the general community in our neighborhoods and our communities versus what's happening in the long-term care facilities. And a lot of these long-term care facilities are seeing unprecedented amounts of COVID. There are real epidemics throughout those facilities, and being able to kind of separate those two pathways for ourselves, making sure we're putting the testing where it needs to be, making sure that we're looking at the data in an appropriate manner. When you're looking at taking steps, whether it's with a retail location or these other steps with hospitals that are still coming out, that have already started some of their procedures as early as this week, those are more, I'd call general community type steps that we're taking, as opposed to the issues dealing with long-term care facilities. So we're just better about being able to separate that data out, looking at them as individuals, if you will, and putting the resources that need to be on each of those pathways.
Now, is it anybody who has symptoms can be tested, or does that person also have to be over 60 or have these comorbidity conditions? Sure. I just wanted to make sure people know how broad, because this is very broad.
It is very broad. So it is anybody over the age of 60. It's anybody with an underlying condition. It's anybody that has the underlying conditions that the governor mentioned: diabetes, chronic lung disease, any healthcare worker. So it is a very broad category. We are not requiring a physician referral for this testing. So you can go to that website, or starting tomorrow, or call that number and be connected with someone that can set you up an appointment. And the website is actually set up so that you can set up your own date and time and the location that works for you. So you get a drop-down menu and select the location that's closest to you, because our mobile sites are up all over the state. So you can select the location, and then you select the time that works for you. You get first, second, and third choice on time, and then you will receive a call back to confirm and to give you further instructions.
Commissioner, it sounds like it looks as if we have one of the highest percentage of deaths occurring in a long-term setting of any state in the country. The other way of looking at it is we have a very low rate of community transmission, as you pointed out. Is that because we have fewer people in this state proportionally that have these comorbid conditions that make them at risk in the community? Do we have fewer of those?
I think there's a lot of reasons there, and I can't point to just one. I think you're right that we're seeing a fairly low rate of deaths attributed to community transmission. So when we look at percentage of death overall, when we have that low percentage of community transmission, our long-term care facility is high. With that said, our long-term care death rate, our mortality rate is high, and the percentage of facilities affected isn't as high as what we see in other states. When you look at other states, I've seen reports of states that have 40% of their facilities in outbreak or 50% of their facilities in outbreak, and we don't have that many. But once it gets into the facility, what we're seeing is significant negative outcomes for those residents.
Commissioner, can you explain why certain facilities see the outbreak really go to an extent such as they have in Pleasant Valley and others not so much? Are there any identifiable things that you could say, okay, well, this went right here or this didn't go right here? What are the differences there?
So based on my 20 years of long-term care experience, right, I don't have data and statistics to tell you why, but after 20 years of running long-term care facilities, I can tell you some of the reasons that I've seen. The makeup of the building. So is the building one or two big units, or is it cut up into 10 small units? What that does is provide a physical separation between the residents unit to unit, and I think that's an important fact. The type of resident that facilities take. We have facilities that focus on, let's say, a skilled nursing population where you have maybe younger residents that need rehab but are planning on going home, and that's a big part of their population, because that population exists in every nursing home, but some facilities have a higher census than others. You have other facilities who have very convalescent residents that are in their late 80s, early 90s, that are just more frail. And they don't have as high a census of your Medicare population that is perhaps a little bit younger, a little bit healthier, and plan to get discharged back home after their stay at the nursing home. So some of it's makeup, some of it's the physical layout of the building.
Can you tell us, of the 19 being announced today, how many of those are from long-term care?
They are all from long-term care facilities.
Commissioner, you've talked a lot about the testing going on in these long-term care facilities. We've heard from some families who are just concerned about the way that if they have loved ones in these facilities, the way that they are addressing, the prevention of the virus getting inside. Can you talk about the oversight that the state right now has on these facilities and how you're checking that regularly to see that what you've recommended is actually being followed?
We are. So we've done 2 on-site audits of facilities that have outbreaks in them. We have done virtual audits, which is really going over what they're required to do from a licensing and certification standpoint. Then we have public health, who has an assigned person to work with that facility to make sure that they understand what's called donning and doffing of PPE, proper infection control practices, appropriate cohorting amongst residents and staff. We have all of those things in place. But I just want to really point out that this is something that we've never had before. COVID-19, right, is something that looks to be more contagious than what we typically see in long-term care. It's like we're fighting an invisible enemy, because initially when we talked about having it was symptomatic people that were spreading the virus. And that was a very important point because we made sure everybody was masked and everybody was gloved and we had appropriate PPE. And the people that were symptomatic got tested. Very quickly, we learned that asymptomatic people were also testing positive. That makes it very, very hard to identify what we're trying to fight, what we're trying to stop from coming in. So as we have, every single day that we have done long-term care planning, we have had to pivot. First we were going one way, and then we get new information about a new case, a new nursing home, and we say, we have to pivot this way. We have to start testing every single patient when there's a long-term care positive because we don't know who's in the building that's positive. We need to start testing all of the staff. And those are pivots that we've made sometimes ahead of the CDC. There are times where the CDC's guidance said one thing, and we are looking at what the situation is on the ground and saying we understand that the CDC is saying one thing. We need to be more aggressive and pivot another way because we're not able to see the symptoms that we thought we were going to be able to see. And with the expanded testing that we've done and with the aggressive amount of testing that we've done, especially in the long-term care workforce, we have over 5,000 of our workforce has been tested. That's a pretty significant number. The amount of outbreaks that we've stopped is really a positive thing, and we hope to have several more that we stop before they ever get into the facility.
For the governor, emergency Medicaid funding, some states have been surging some of that towards long-term care facilities, nursing homes. Is that something that's on the table for you?
Absolutely, yeah, absolutely. I mean, there's a variety of different emergency Medicaid funding that you can put forth, not just in terms of long-term care facilities, but in a variety of other areas across the state. We've already begun with those long-term care workers working in Medicaid-based facilities. We've already started that process here. We've allocated approximately $75 million. I think I have that. I'm doing that off the top of my head, but I think it's about $75 million between now and in the next few months to provide that additional stipend for those types of workers. And there's other areas within the Medicaid field that we can also provide some of those emergency funds. Do you want to do? Oh, sorry. Go ahead, Kevin.
Perhaps if you had any reaction, Governor, to the Executive Council's decision to table the warrant, which
No.
no.
No, we provided a lot of, again, the warrant articles come to the executive councils. It's basically a mechanism by which if you weren't going to support the warrant article, effectively you shut down all of government. That came forth. It simply allows the Department of Administrative Services and the Treasury to keep the cash moving, so to say. So they wanted to take a look at both the traditional warrant article as well as the items that were included as part of the COVID dollars that are already been authorized and are going to be put out. We provided a lot of detail in terms of all the different categories that those dollars are going to be put out. They wanted to look at it for another couple of weeks, which is fine. It doesn't go into effect until June 1st. It's really the warrant article allowing cash for June, so we can meet at the next meeting and obviously assume that they're going to move it forward as opposed to shutting down the entire government. So nobody wants that.
Are you going to provide any additional information to them that they're seeking?
Sure, they weren't very specific about what they were looking for, but we'll provide any additional specifics we have. We're always happy to provide. We've been very transparent through the whole process. It's all out there on the Gopher website. It's traditionally those warrant articles are literally one or two sentences. So we've provided just in this week we provided a lot more detail than we typically provide in any warrant article, but we can provide more if they need to. That's fine. Yeah, we're always willing to provide. Ultimately, every dollar that's being spent out of Gopher, every dollar is going to be available and transparent, not just to elected officials, but to everybody in the state. Everybody is going to see every dollar. So, and again, some of it has been approved but not actually allocated yet. For example, there are some facilities where we've allocated dollars for long-term care for Medicaid long-term care workers, but they haven't actually been drawn up yet. Some of those facilities are still going through the application process for whatever reason. So the funds are still there, and they can be drawn down whether it's today or tomorrow or down the road. So again, it's kind of a rolling and very evolving process. But whatever details we have, it's all very open. We're an open book about everything we do.
In relation to sort of Gopher's operations in the business world, business liability. Down in Washington, Senate Majority Leader Mitch McConnell has said that it's a red line for Republicans there to provide businesses protection from lawsuits based on returning to work and COVID-19 and things like that. Here, the BIA has asked you to take a look at something similar. What's your perspective on this? Should businesses be protected from lawsuits based on
So the idea of protecting businesses from lawsuits is a very serious issue. I have to say we're looking at it. I think that there are a lot of businesses that should be protected, absolutely. It's really a federal issue, not to just punt, but given that we have so many of our workers and our businesses that deal with workers across the border, right? And on any given day, we could have 100,000 people working both from out of state, working in state, or living in state and working out of state. So I would hope that the federal government would take it up. We can do it on our end as well, but it really is a national issue, especially for a regional location like New England where we have so much cross-border. You'll get a lot of confusion if New Hampshire's doing one thing but Maine or Vermont or Massachusetts isn't doing something similar. So we can definitely go down that path, but I'm hoping that the federal government works it out, takes it up, and I definitely appreciate it is a very serious issue in that there's a lot of businesses that simply will not open. They're afraid to open because of the potential liability for themselves or their workers or even their customers, right? So looking to provide some of those protections to get businesses to open up, to allow things to move forward would be very important. Do we want to take some on the phone?
First question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thanks. I have a quick numbers question for Commissioner Chiffonnet and then a broader question for the governor. The first question, you mentioned the number of long-term care facility residents and staff that have been tested so far statewide. Can you give an estimate of the total population? So roughly how many such residents and staff are there across the state? My second question for the governor is, when you were answering Adam's question, you talked about separating what's happening at long-term care facilities from what's happening out in the community, but these facilities don't exist in a vacuum. The workers are out in the community. So if someone, say, has a loved one in a nursing home, how concerned should they be about one of their caregivers going out to a retail store or a hair salon as things start opening back up?
So I'll let the commissioner take the first part of the question. I'll take this.
Thank you for the question. So I don't have the exact number of those figures that you're looking for, but I'm going to try to pull something from memory from at least a couple of years ago. So back when I was in long-term care, we had somewhere between 2,500 and 2,700 nursing home beds. So we've tested about 1,000 of those residents. And I'll just add that if I'm way off on this, we'll correct it after I get back. The 5,000, I don't have a total number healthcare workforce for that to be able to give you a total number, but my estimate is somewhere around 18 to 20,000. So, yep.
And I would just add to the second question about the concern of healthcare workers, utilizing some of the businesses or facilities as we kind of take steps forward. I'd remind everyone that all the guidelines that we've put into place have been approved by the Department of Public Health. And if those guidelines are adhered to, I think across the board people understand that there is a low risk. We do not believe that by taking these steps forward with a retail, with hospitals, with golf courses or campgrounds, there isn't a belief that this is going to drastically increase community-based transmission. I mean, that's exactly why you have public health, reviewing all of these guideline documents, making sure that people are using the cloth face coverings, sometimes even the customers in certain settings, making sure that we're recommending that anyone going into those facilities is utilizing those physical distancing and those sanitary measures of protecting themselves and the folks that they're potentially going to be around in those settings. So that's exactly why we have the Department of Public Health review all the guidelines going forward to ensure that we're not exacerbating the community-based transmission within the general the population outside of long-term care facilities.
The next question comes from Ethan DeWitt with Concord Monitor. Ethan, go ahead with your question.
Hey there, so I wanted to ask about testing eligibility. So right now, I believe you only need one symptom to get a test. Is it at all plausible in the near future or just future that there will be enough testing to be able to comprehensively test people whether they have a symptom or not, especially as people start returning to the workplace? And then kind of to follow up on Holly's point and kind of to this bigger point, it seems like the state's approach right now is geared towards the long-term care facility issue of spread. And it's geared towards the assumption that community spread is non-existent or is low now and will not be likely to rise, as the governor just said. If that changes, does the state have enough material to quickly pivot? Because right now it seems to be putting all of its testing resources into long-term care facilities. Could we pivot to dealing with a community-wide problem and potentially needing much more expansive mitigation measures if it came to that as we start to reopen? If the numbers do go up?
So I have to push back a little bit. We're not gearing all of our testing capacity just to long-term care facilities. We just announced that anybody in the state can go online to the nh.gov website. If they're over 60, they can apply for a test. If they have any symptom, they can apply for the test. If they have underlying health conditions, they can apply for the test. You don't have to be in a long-term care health facility for any of that. So we just have expanded our capacity such that we can focus on long-term care facilities as well as providing adequate testing capacity for the general population. We always want to see it increase. We want folks to be able to step forward, and if we can get to the point where we're just testing everybody across the board, we're taking every other day we seem to be taking another very significant step forward. Just the fact that the test is becoming so much easier, and now you can just do basically an easier nasal swab as opposed to the more invasive testing procedure alone, we think will entice more people to step forward and want to be tested. That allows us to have the data and be able to provide either the quarantine or the segregation of those that might be COVID positive or otherwise. So we're really going down two paths very aggressively, both within the general community. There is community-based transmission. Absolutely there is. We're not saying there is not, by no means. But again, by having this testing capacity, we can identify it quicker, we can mitigate it a lot faster, and really contain that epidemic spread, given, as the Commissioner was referencing, how contagious this is. I'll refer to the Commissioner on any additional details with the long-term care facility.
So the only thing that I would add is this has been a phased approach all along. That our initial steps were to take care of the most seriously ill, and that is when testing materials were in very critical levels. And as you've seen as the weeks have gone by, is we've opened up our testing more and more every week. First it was critically ill, and then it was mild symptoms with a doctor's note. At the same time, doing long-term care, doing asymptomatic testing and long-term care for staff and residents. We're now moving the platform. The next phase is not just mild symptoms, but people that have underlying conditions that put them at risk for negative consequences. So the underlying medical conditions, the over 60, the healthcare workers. So you can expect that there will be a phase 3 where we're doing community surveillance, which is what it's called, right? Community surveillance. We're taking, a sample from a diverse background of people in New Hampshire from all different regions, asymptomatic, and testing them. And then, phase after that will be some antibody testing. I think that we're right in the middle of the phases of scaling up widespread testing. So I think there's more to come on that.
The next
Thank you.
question comes from Nancy West with In-Depth. Nancy, go ahead with your question.
Yes, hi. I did want to let you know, Governor, that I've heard from nursing homes that they don't have enough disposable gowns and they want more frequent testing. But my two questions are, given that at least 78% of the COVID-19 deaths have been in nursing homes, Governor, do you think you've done enough to protect this vulnerable population? And I know you're aware that Senator Feldt has been calling on you to test all residents and staff at the long-term care facilities. But he would also like to see canceled contracts with Convenient MD. He claims they're not doing the job. And I'm wondering if the reason you haven't canceled that contract is because the company's co-founder is a political donor to your campaign.
So I'm not going to respond to any of that political nonsense. Those questions are politically driven. Nothing we've done has been politically driven into. Convenient MD has been a terrific partner that was set up by the Department of Health and Human Services. They've tested literally thousands upon thousands upon thousands of people in the state. They've done a terrific job. So when it comes to the doing, quote, enough for long-term care facilities, my opinion is we can never do enough. We're always going to strive to do more and more and more. We're always going to keep pushing the limit. As we have more, every time we have an increase in our testing capacity, we're making sure that it's available not just to the general public, but focusing on those areas that are hardest hit, which is the long-term care facility, exactly what we're talking about today. The fact that we're getting to the point where we can do random asymptomatic testing in the coming weeks into those facilities with those workers and those residents, again, kind of that random testing that allows you to get a better sense of what's really moving out there asymptomatically is a huge opportunity for the state. And I think the department has done a terrific job at doing that. All of our different partners, the folks in the public health lab, the folks at Convenient MD, the folks that are helping us stand up the 5 fixed facilities that we now have across the state, the folks in the National Guard that have been helping, the folks at the city level, the folks at Dartmouth Hitchcock, everybody has come together to help make this testing capacity increase day by day. And again, we're putting that capacity every time we have it, we're doing more and more. The issue isn't money, it isn't funding, it's simply about getting the supplies into a state that right now doesn't have as high of an impact and transmissivity level as a place like Massachusetts or New York. We know we sometimes take a bit of a back seat to those states because they are the ground zero hotbeds across the country right now. But we're still doing, I think, a very, very good job of constantly working to increase our capacity, getting those results, going from a couple hundred tests just a few weeks ago to 12 to 1,500 tests on any potential given day here in New Hampshire today, and actually being able to push those limits, increase that capacity, get it right where it needs to be. I'm going to ignore all the other political questions you just asked because that's just what they are. It's political, and we're not dealing with that in any aspect of what we do here to make sure that the people of New Hampshire have not just the relief efforts they need, the testing capacity they need, the PPE they need. It is an all hands on deck effort. Politics doesn't come into play with any of it.
The next question comes from Michael Graham with InsideSources.com. Michael, go ahead with your question.
Like Holly, I'm going to give a math question to the commissioner and then go to the category of potpourri for Governor Sununu. The weekly COVID-19 data has not been updated since the week of April 27th. Will you be updating that information soon, and will you start including data other states regularly include about the demographics and comorbidities of the hospitalized and fatalities? Governor Sununu, over in Portsmouth, the health officer says that your standards for restaurants are not sufficient, and she claims a majority of the restaurants don't even want to open. In Salem, they're discussing a mandatory mask requirement similar to Massachusetts because they believe that they need one. Are you comfortable with the cities and towns taking their own steps that exceed or go beyond the guidelines you've set? And do you agree that the guidelines you're using aren't sufficient?
So this is Commissioner Shibinette. I'm going to take the first part of the question. The weekly demographic report that you're asking about was last published last week, and it will be updated this week. And it's set to be released either today or tomorrow. I'm not sure that there is any new expanded categories on it this week, but we are constantly pulling our data. I mean, one thing that we do have to look forward to is that there is going to be a dashboard at some point in the coming weeks from Public Health that will have data on it daily and updated in real time. It really is about getting that dashboard up and running. But for right now, we are manually pulling that data by hand and making sure we have all of the data that you ask for and that our citizens ask for to be most informed about COVID-19.
And I would just add that if anyone is questioning the steps and the approved health and safety steps that Dr. Chan and his team at the Department of Public Health have taken. We have some of the best people, not just in the state, but in the country right here in New Hampshire, helping us make decisions on the guidelines that have been taken. So if people are questioning any of that, I suppose they can take it up with the folks at Public Health, but they do a phenomenal job. They're renowned across this country, and we're very proud to have them. So the guidelines we put forward, we feel are adequate. Otherwise, we would not have put them forward. If towns want to take additional steps, that by all means, that's definitely their choice to do so. They have that right to do so in a public health emergency. I would say that a lot of restaurants, we've heard of a lot of restaurants aren't looking to open right now with the expanded opportunity for outdoor seating because it still doesn't meet their economic model. And we understand that not everybody was going to be able to work within the guidelines and constraints that we put forward, but we are going to take this stepwise. We're not just going to open everything aggressively. We're not going to be too dangerous about what we do, for lack of a better term. That model works for some but not for others. We understand that. We're not mandating that anybody opens. We're simply providing that opportunity for those who the guideline fits. And then as we see numbers continue to get better, as we increase our testing capacity, we can take further steps.
The next question comes from Rick Green with the Laconia Daily Sun. Rick, go ahead with your question.
Hi, two-part. One having to do with how many people have died in long-term care to date in New Hampshire, including a breakdown of the facilities involved with the 19 today. And then the second part is just with the enhanced testing, am I understanding it correctly that you do not have to have symptoms to be tested if you are over 60 or have these underlying conditions?
Sure. So that's the second part of your question is right. If you're over 60, you do not have to have symptoms. Or if you have underlying conditions, you qualify. Or if you have symptoms, you qualify. So again, it's a very broad opportunity for testing all across the state, and our partners that have been able to help us do that have continue, I think, to do a fantastic job. I don't know, Commissioner, do you have any of the details specific to the unfortunate mortality as it pertains to long-term care?
So we can have Jake touch base and get him that.
Okay.
We released that information yesterday, so we'll have Jake touch
So
base with him.
So the commissioner is saying that we put some of that information out on the long-term care facilities yesterday, but we'll make sure we update it and release it. We just don't have the numbers with us here this moment, but we'll make sure the press gets all that.
The next question comes from Josh Rogers with New Hampshire Public Radio. Josh, go ahead with your question.
Thanks. Good afternoon. I just want to return to nursing homes for a moment. And, data from the Kaiser Family Foundation shows that New Hampshire may have the highest rate of COVID-19 deaths in nursing homes of any state in the country. I know Commissioner Shibinette said that COVID-19 is something we've never seen before, but how did we get to the point where we may have the worst rate of death among people in congregate living situations?
So I think you're referring to the highest percentage of death of the as compared to the overall death rate in the state. So it is not the highest rate of nursing home deaths in the state. It's as a percentage of the total death. And as we've talked about, is that a lot of we've done a lot of work on reducing community transmission. So our overall rate of death within our communities is low, and our nursing home rates are higher. By no means do we have the highest number of nursing home deaths in the country. So I wanted to clarify that point first. So why is that? I think we've talked a lot about that, for several weeks now. We have a frail population. We are the third oldest state in the country. I think there's a lot that go into it. I think that we've taken some aggressive actions right from the beginning on testing based on what we had available to use. There is always a point where I can say, I wish I would have had the supplies on the 1st of March to go through and test all long-term care staff, but that's not reality, and we didn't have those supplies then. We do have them now, and we're coming out and we're testing everybody we can.
Comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
Yeah, good afternoon. I'd like to ask a question about the death count. I know it's a sad thing, but I'm still curious about when you say a death is related to COVID, is that to say COVID caused the death? And also, how do you confirm it is related to COVID? Is it symptoms observed by the victim, or is there testing? And if so, is that testing in all deaths, whether it be prior or post-mortem?
So I'm going to see if I can take that question. So a COVID-related death, there could be several comorbidities, and COVID being, one factor in that. As we've said, patients that have major underlying comorbidities, things like chronic pulmonary disease, congestive heart failure, diabetes, renal failure, liver failure, or disease, COVID, on top of those things, creates an environment where the person gets very ill. So it is a contributing cause to death, not necessarily the only thing that caused their death, but certainly a contributing cause to death. To verify death, we look for a physician statement that it was COVID related, and whether it, or if it's on the death certificate saying that it's COVID. So in most of those cases, yes, there is a definite positive. I'm not going to say 100% because I don't know if there's outliers, but in the vast majority of the cases, there's been a test that confirmed a COVID positive patient.
Okay, I think we're all set on the phone. Anything else here? Adam?
What about businesses that are looking to reopen and they can't find enough workers?
Businesses that are looking to reopen, like a retail store that can't get their workforce back.
Who don't want to come back, or and you can't find enough.
Unfortunately, that's going to be an issue for a variety of different businesses in a variety of different sectors. There's a lot of folks on unemployment, and the unemployment benefits are very strong right now. That's providing a lot of opportunity for folks at home to make sure they're paying their rent and their utilities. Incentivizing and enticing those workers to come back into the workforce is going to be a challenge, not just because of the financial aspects, but the health and safety aspects. We're obviously trying to make sure that we are providing that PPE, the guidance, so workers feel comfortable coming back in. Beyond that, again, the government can't mandate workers, get back into work. We allow a lot of flexibility with the unemployment insurance. It's the right thing to do. I really believe that, at least as we go through these initial months through this crisis. What the federal government does in terms of their unemployment insurance stipend that they've put on top of our unemployment insurance as well, I'm not sure in the long run whether they start tapering that down or don't allow it. My guess is that would incentivize some workers to come back. We have a lot of employees right now that are and employers that got PPP money, which is very good. I think 11,500 in the first phase and definitely a lot more in the second phase. Businesses here in the state that received over $2 billion in basically zero interest loans and ultimately low interest loans that will ultimately, for the most part, turn into grants. A huge opportunity, and all those dollars are really focused on providing employment for those employees. When you get past that 8 weeks, those businesses are hopefully the economy's back into decent shape. The businesses are moving forward. You could see another potential surge if those employees say, "Well, I'm going to go on unemployment now." We don't want that to happen. Obviously, that's why we're trying to build an 8-week bridge here to get the economy moving again in some facet, so that again they can retain employees and we don't have more people falling off to the unemployment insurance rolls. So it's a challenge for a lot of different businesses. We've heard it. Again, the government can't mandate somebody, get back into work. We've provided a lot of opportunity for folks to feel safe and comfortable as we go through this time. But for businesses that can open, the opportunity is there.
With regard to the stipend for first responders, Governor, what about volunteers? A number of communities rely on volunteers to do a lot of this first responder work. And could you answer those who say they do a lot of great work, but doctors do a lot of great work too, and nurses do a lot of great work.
Sure.
Even grocery store workers out there are taking a lot of risks. So where's their stipend?
Sure. So we've provided a stipend opportunity for a couple different folks. We've really gone after the ones we could and frankly I think should go after first. Those that are frankly drastically underpaid in the Medicaid field in long-term care facilities. The frontline first responders that put themselves in very physical, very close coordination and one-on-one with citizens on a moment notice, whether it's for a rescue or saving someone or maybe even in an arresting situation, whatever it might be. Those individuals are putting themselves right out there, so we want to make sure that we're incentivizing them. Is there other opportunity for other areas of the workforce? Sure. I mean, look, you could go, very few folks are going to be in the workforce now and have virtually no contact or communication with anybody else. So you could probably justify everybody if you go down the list far enough, but we're going to prioritize in the state we have. Can we take more steps with stipends in other fields of workers, whether they be nurses or doctors or dentists or other folks out there? Sure, there's always an opportunity to do that, and we'll continue to look at that. I think the Gopher Committee will continue to look at where those relief funds potentially could go, and also balancing it out with the other needs, whether it's with small business needs, healthcare needs, other nonprofit needs, whatever they might be. So there's going to be an opportunity for a lot of money to be out there. We want to make sure it's dispersed equitably, fairly, and prioritized.
Before the stay-at-home committee, before the reopening task force,
Yes.
getting all of my things mixed
Task
up.
force committees, commissions, reopening, I get it. It gets a little confusing. But
You had some amusement industry folks testifying yesterday that they were hoping for a soft open on places like Canopy Lake Park and Storyland in a month and a half. Does that sound realistic to you?
It's not unrealistic. It's a challenge. I think our numbers will obviously dictate whether that's really possible or not. And not just the numbers in New Hampshire, but unfortunately the numbers in our surrounding regions. I mean, these are venues that really cater to out-of-staters, really cater to a Massachusetts crowd. As somebody that used to be in the travel and tourism industry, we relied on anywhere from 50 to 60% of our customers coming from out of state in some fashion. New York, New Jersey, Connecticut, Massachusetts. That's where there's a lot of financial opportunity to keep the business running. Canopy is the same way. Canopy Lake Park is literally on the border of Massachusetts, literally. So they have a very high percentage of folks to come in. No one wants to see those businesses open more than I do. They are the bread and butter of this state, especially during the tourism season. But there is huge risk there as well. So we just have to be very cautious and very realistic about what is possible. I would love to see it happen, but I mean, again, I go back to that visual as someone who has spent many, many days in Canopy Lake Park and could draw a map for the entire place with my eyes closed. But it is a place that is driven on a lot of excitement, tens of thousands of people sometimes in one tight place. There's people are sweating and they're running around and they're having a great time, and there's the water park and you're touching things, you're touching the handlebars of something or the rides or whatever it is. It's really not conducive to maintaining physical and social distancing. It's not designed like that. So I think Canopy Lake Park is one of the best tourism and recreational venues in all of the Northeast, but it's really going to be really hard. In a month and a half, maybe. I don't want to say no. I don't say no to anything, but there's going to be a lot of challenges there, and a lot of it is going to be out of our direct control, right? I mean, we can put in the PPE and the physical distancing and take safe steps, but we just have to make sure that we stay disciplined. I don't mean to go on a tangent, but a lot of people say, boy, you got to open up fast to support the economy. If you don't open up smart, you're going to put the economy in a much worse economic position in the long term. My job is to play for the long term here. Whether we have to wait an extra week or a couple extra weeks on some of these things, but we do it right by doing that, that puts us in a much more economically favorable position as a state in the winter or next spring or next summer, or being able to deal with the second surge, whatever it might be. So by being smart about what we do today and being patient and disciplined and making those very tough decisions to wait another week or 2 weeks or whatever it is, it definitely helps us out for the long term. And that's one of my jobs, is not to just cave into pressure because all the pressure says to open up right now. You gotta be smart about it. And God bless it, we have some incredible people in the state that help us advise to that. We lean on Dr. Chan. We lean on, the Department of Public Health for a lot of the health and safety issues around the guidelines that we put forward, the timing of what we do. It all is done hand in glove with our partners across the state. And again, we're listening to a lot of those. We're bringing them in, listening to the presentations, listening to the businesses, allowing them to be part of that creation of the guidance. I think that's a very positive step. But the timing is really, really important. And if you get that wrong, you can put yourself in a very precarious position in the long term. Great. Did you have something? Oh, you're all good. Okay, great. The commissioner stood up, so I didn't know if we had something else. Well, look, thank you, everybody, for taking the time today. I think this is great news in terms of expanding testing capacity, making it really available to a variety of different citizens. A new way of doing testing is much easier, much simpler, and every day we seem to be coming forward and providing another opportunity, and that's just, I think, a testament to the folks at Health and Human Services and what's being done in the state. So we just can't thank them enough. We got a great team here, and we're going to keep using them as we go forward. Be safe, everybody. Thank you.